Hello, good afternoon. Oh, I can see some names I haven't seen in a long time. I can see Victor Uti's name. Um, Dr. Ademola, thank you for organizing this. Can you hear me?
Hello, Dr. Dairo.
Good evening. How are you?
Fine, thank you.
Um, I think we have chosen a very interesting day. Happy Father's Day to you. And I didn't realize when we were agreeing the date that it was clashing with Father's Day and I think it's also Eid today, so there's a celebration going on. But we see who can turn up.
I really hope we'll have a good turnout. I know some people have been in touch. Sorry, I think there's a bit of air going on. Let me just stop it here. Okay, please, can you still hear me?
Yes, we can hear you
Okay,
before,
yeah.
and we can hear you now.
Okay, I've removed the airplane now. So I think we should still have a good turnout. Um, a number of people have been in touch, and hopefully we'll have a very good day. Thank you for honoring the invitation as speaker.
Oh, thank you for having me. I was just saying as I was joining that I can see names of people that um, I haven't seen in like maybe almost 30 years. So that is interesting and exciting in equal measure.
Please, I'm sorry, if you don't mind, should we give it a minute or two? I'm looking at the numbers there currently. Should we give it just a bit of time? And then if we have more people, if that's okay
Yeah,
by you.
no, that's okay by me. I just want to check because how long, when do you hope to finish the meeting? How long is the meeting for?
Okay, we're looking at the seminar lasting roughly an hour. So if we can
Okay,
finish about 5:30, that would be great. And
okay,
then we will just have a short break before we go on to start the special general meeting.
okay. Yeah, I will. Yeah, from my end, that's fine. My presentation is, I've tried to cut it down because it's Father's Day and there are people who are also celebrating. And so don't want to keep people here unnecessarily. So I've cut it, I've taken out the videos and things, but the link to the videos I will share with everyone so that people can watch it afterwards, and so you're not missing out on anything. I've just tried to condense it so that we can finish and have time for questions and discussions and conversation and anything anybody wants to do, and still making sure that we finish on time. So I'll wait until people are here before I put um, the link to the resources in the chat box.
Okay. Please, I will just as maybe it's a matter of protocol, just do a brief introduction. I know you're really ready to go, and maybe that will be just a minute, two, not more than that. Is that okay?
Yes, are we starting now? Are we starting at 4:35? Just to give people, I thought we were
Yeah,
waiting for,
4:35 is fine.
yeah, okay.
Oh, Dr. Ajile, good afternoon.
Good afternoon, Dr. Adekunle.
Thank you for joining
Good
us today.
afternoon, Dr. Dairo. It's
Good
my pleasure to
afternoon.
be here.
Oh,
Lovely
yeah.
to see your faces. I'm happy to be a participant in this very important and very illuminating discussion that we're going to have this afternoon. Thank you for being making yourself available for this presentation, Dr. Dairo.
Thank you. It's my pleasure. I'm delighted to be here.
You're welcome.
Okay. I think we will just make a start. Sorry, just checking. Can you still hear me properly? Okay, thank you. I welcome everybody to the seminar of the Nigerian Physiotherapists United Kingdom. I would just quickly acknowledge the presence of some people here, and then I will move on to introduce our very important speaker of today. Thank you, Dr. Olayiwola Ajileye, the President, Ibadan College of Medicine Alumni Association, UK Ireland. We are also expecting a few more people. I'll be introducing them as they come in. In introducing our speaker of today, she's a woman of few words, so she doesn't want me to say so much about her, but we just have to say a few things. Dr. Yetunde Dairo is an associate professor of physiotherapy at the Buckinghamshire University. And in May 2004, she was appointed as the research lead for the School of Health and Social Care Professions. Now, she has previous experience as the cluster lead for allied health professions and advanced clinical practice, and more recently as the interim deputy head of school of health and social care profession, Buckinghamshire University. I mean, as part of the school leadership, Dr. Dairo has experience in managing physiotherapy, physician associate, and social work teams. And she has successfully led and supervised the teams to ensure the delivery of high quality education and achievements, organizational achievements. Now, in training and qualification, Dr. Dairo has very rich history. She earned a PhD from Oxford Brookes University in 2017, focusing on physical activity. And this achievement was preceded by a master's degree in rehabilitation science from Southampton University in 2005, and her bachelor degree, which she had in physiotherapy, which she had from the Premier University in Nigeria, the University of Ibadan. Our academic journey is complemented by her development of MSc and BSc physiotherapy registration programs at universities in UK and abroad, a number of those universities. Now, Dr. Dairo's professional journey in the UK spanned over 17 years, including within the NHS as a clinical specialist neurophysiotherapist, and the complex health and physical disability lead at Southern Health Foundation Trust in 2014. She transitioned to academia, starting as a senior lecturer at the London South Bank University and focusing on her specialty, which again is neuroscience. And she returned to clinical practice between 2011 and 2014 before proceeding again on her PhD program. She has been developing programs across different universities, and that included the St. Mary University and London, and also as assistant professor at Coventry University in 2020. And these are in addition to her leadership role at the Buckinghamshire University. She teaches postgraduate students as well as supervised research programs in PhD and others. She has worked within the Health HCPC as the Health and Care Professional Council as a partner and as lead visitor and chair of the council's approval panel in 2023. So we have here a personality with such rich background and experience, and we're looking forward to benefiting from her experience. Now, she's demonstrated her commitment to maintaining the highest professional standard and adhering to the regulatory requirement by the Health and Care Professions Council. I have the honor of introducing Dr. Yetunde Dairo as our speaker of today. Thank you.
Thank you, everyone, for that very warm welcome and the very comprehensive introduction. Can I just, it'd be nice to see everyone. So at the end of my presentation, if people don't mind just kind of showing their face and saying hello, that would be brilliant. Dr. Adekunle, can I start now? Can I go ahead and start my presentation?
Yes, you can go ahead.
Okay, I'm just setting my timer to help me with my timing. Okay, welcome once again, as I said. So I've been asked to talk about collaborative practice in the 21st century. So I've just kind of taken on the 21st century from my talk so that I don't keep repeating that. So everything I'm sharing this afternoon is very modern indeed. And so I will share my screen with you shortly. Just bear with me. Okay, the host has disabled participant sharing screen. Dr. Adekune, can you allow me to share my screen, please?
Yes, I'm going to do that now.
Okay, thank you.
I think the easiest way will be to make you the host, and when you are finished, you can just transfer the hosting back to me.
Okay,
so you should be able to do that now.
Yep, it's showing that I'm now the host. So let me try again. Screen. Can you see my screen now?
Not yet. Probably something is coming.
Not yet.
Okay. Let me try this one. Can you see my screen now?
Yes.
It's not displaying well from my end. So Dr. Ademola, can you confirm that you can see it very well?
We can see it. I don't know, maybe if you can use the
slideshow
to make it, slideshow to make it.
Yes, I've put it on slideshow now.
Okay,
so
it's better. Yes,
it's okay now. It's okay.
It's okay now. Okay. All right. So collaborative practice using co-creation in healthcare and leadership for physiotherapists. But actually, the concept of collaborative practice and co-creation is applicable across all professional growth, not just in health, in any area of life where you have to work with people. Any form of collaborative research, collaborative working, collaborative projects, collaborative practice, and co-creation is relevant. But I'm mindful that majority of the people on this call are physiotherapists. So the examples that I'm sharing or that I will be sharing later naturally does have physiotherapy bias. There are different ways people look at collaborative practice. I like to look at collaborative practice from a co-creation perspective. So I'll introduce collaborative practice with a background and explore what co-creation means for everyone on this call this afternoon. Collaborative practice is integral to the NHS framework. For those of you who work with the National Health Service, and it basically promotes multidisciplinary teams to deliver patient-centered care. So the idea of collaborative practice was initially developed as a means of improving patient-centered care, as a framework to bring different people together for the benefits of the patient, but it goes beyond health, as I said in my introductory slide. Co-creation, joint co-creation of value by professionals and stakeholders. As I said at the beginning, there is no way you can talk about collaborative practice and you talk about it in isolation or in silo without linking it to how to work with people, how to engage with people. And so the principles of co-creation is one of inclusion, engagement, shared goal, and collaborative practice. Co-creation refers to research or projects that include or involve collaboration with stakeholders, either throughout a research or project. And so anything you do either from inception, involving stakeholder, asking for people's view, carrying people along. All of that is co-creation and is the key foundation for collaborative practice. But the role of physiotherapy in collaborative practice, as you all know, the scope of physiotherapy is very wide. We have physiotherapies in clinical roles, we have physiotherapies involving patient interaction, and we have physiotherapy in rehabilitation. And in all areas, actually, we have physiotherapy in education, in management, and all areas of healthcare. The importance of collaboration, it helps to enhance patient outcome, and it also helps to promote interdisciplinary teamwork. There are different methods of fostering inclusive engagement. So if you look in literature, depending on what your goal is, there are different recommendations. What I have done for the purpose of this presentation is to just pull together key points. So if you're here today and you're thinking, how could you be more inclusive? How could you facilitate collaborative practice, regardless of where you're working or what you do? These are some of the things that can help to foster that inclusive engagement. One is inclusive research methodologies. Secondly, creative approaches to engagement. Thirdly, education and skill development. And lastly, empowerment. And I'll just briefly describe what each of these means. Inclusive research methodology. For example, in the research that I do two types of research primarily. So I look at inclusive education, which is where this collaborative practice work link into. I also do research in physical activity in special population. And some of the people that I deal with, they have profound and multiple cognitive and physical disability. And so if you just present things to them, they won't be able to engage. So they may not be able to engage either because they have communication difficulties or they have physical impairment that stop them engaging. So every time I have to write something, every time I have to design an intervention, I'm thinking about inclusion. How can I reduce barriers? And that is one of the, when you look in literature, that's one of the most effective way of fostering inclusive engagement. If you're not inclusive, you can't be collaborative, because that means that everything you do, you will be excluding some certain group of people. So it's a fundamental principle in collaborative practice to think about inclusive methodologies. I said research methodologies, but actually it doesn't have to be research. Perhaps you should just think about it in terms of inclusive methodologies. So the way you write things, the way you present information, the things you ask people to do. We need to start moving towards making sure that everyone, irrespective of their ability, can take part in those things. And so inclusive methodology involves looking at removing barriers, not even modifying them, because sometimes modification can just be very cosmetic. So we have to aim at removing barriers to be truly inclusive. So the second point I have here is about creative approaches to engagement. And that means thinking outside of the box. And in my experience, from the work that I've done, it's only actually truly achievable by working with other people. So because unless you engage others, you may not know what inclusion means for them. So for me, I don't have any disability. I'm not registered disabled, but for a very long time, if anything involves me not being available during the school holiday for my children, I don't take part in it. So that excludes me. So for me, if somebody wants to involve me in things, until very recently when my kids don't need me anymore during school holiday. So a creative approach to engage me in things will mean making them happen outside of the school holiday. That's for me, so it's about finding out what it is that makes a difference to be able to engage an individual. And that's not constant. Going back to the example that I gave of myself, for example, so maybe like 3, 4, 5 years back, that was relevant, school holiday. I'm now approaching a phase in my life that's no longer relevant. But I'm sure there will be other barriers that I have to grapple with if somebody wants to involve me in a particular work. So the creativity is about underlining the fact that one cap doesn't fit all. And to get people to work with you, to be truly inclusive, you have to kind of tailor-made these things that remove barriers for the individual. And then education and skill development, don't take things for granted. When you're talking about inclusion, creative approaches to engagement, we also need to be thinking about developing skills, because sometimes just even developing people's skill in itself can take away barrier and allow us to achieve that collaboration, be it in education or in leadership. And finally, if we take all of these into consideration, if we're inclusive and we use creative approaches to engagement and we identify where skills are needed to be developed, we truly empower people, and then we can start to look at collaboration. So these principles that I'm sharing with you this afternoon is very busy slide. I adapted it from some of the work I do with some other academics from Brunel University, Oxford Brookes University, and Canterbury University. So a group of us, we're looking at our co-creation principles. And so this is from one of our work that I'm hoping will be published very soon. So if I can just draw your attention to the left side of the screen. So these are the principles that we have used in the work I'll be sharing with you. The 2 examples I brought to share with you this afternoon, and it's worked really, really well. So I've already talked about inclusion. So, and I think you can't emphasize that enough. I think when you think about collaborative practice, regardless of where you're looking at it from, the first thing in my view has to be inclusion, inclusive practicing. How can we make sure that nobody is left behind? How can we reduce or remove actually barriers for people so that they can be empowered to do whatever it is we want them to do? It's also collaborative, so if you're inclusive, you'll be collaborative, because to be truly inclusive, you have to work with people. Like the example that I gave you, and just looking at me, it's not written on my forehead that, I can't work in school holidays, which was the case for but I worked in the NHS for 17 years. That was one of the things I struggled with when I worked in the NHS. That was probably what drove me away from the NHS at the time. So being inclusive naturally lends itself to collaboration. But if you're not inclusive, you can't be collaborative. But it doesn't stop in being collaborative. We then have to be supportive. So when you include people to work with you, you have to put things in place to support them so that they don't fall off and they can see whatever it is you're doing, they can see it through. And then you have to acknowledge it, because sometimes we take things for granted. We need to acknowledge what those barriers are, what we've done to remove them. And it's a continuous process. It's not something that once you've done it, it's done. We need to continuously acknowledge it. And finally, it's got to be safe. People need to be able to be themselves. whether you're looking at collaborative work in management, I manage a group of people, and I have done for a number of years now. Even before I left, when I was in NHS, I started managing people in NHS from 2003, actually. So I've had about 21 years of management experience across clinical and academic environment. And sometimes this environment, they can create an unsafe environment, especially for some of us that are from a different background. And so I use my experience, everything that I've experienced, I turn it in, I put a positive spin on it to ensure that the collaborative work I do, I make the environment safe, and I encourage people to be their authentic self. So that's what the left side of this diagram is about. And so the central parts of the diagram just give very basic principle, like I said, that we have found from some of the work that we've done and we continue to do, is about identifying and building partnership. So if you manage a group of people, you need to identify those, you need to do certain things with, and how you can partner with them. And where you don't have the sufficient type of partnership within your immediate vicinity, is about looking for a way to reach out to where you can get them. But you don't do this alone. You must always co-explore what's needed. You must co-define the scope. And whatever it is, whether there's a training or whatever it is needed, you need to think about co-development, co-delivery, co-evaluation. That, to me, is what collaborative practice looks like in practice, which is different to what you read in textbooks or in journal articles. So collaboration in a nutshell, before I move on to the next slide, it's about, you need to have principles as set as on the left side on the screen. And then it is not a static process. It's something that is continuous and it never ends. So if you look at this diagram that I have here, after the co-evaluation, it's likely that you start again, because your co-evaluation will identify the areas you need to build partnership, and then you go through this all over again. So it's a continuous loop, and you need to keep referring to your principles so that you stay on track. So key areas of activities, you could use collaborative practice and co-creation in education research. So if you're on this call and your core business is education, you could use this for teaching innovation, curriculum development, and student well-being. This list is by no means exhaustive. These are the common examples you find in literature where people have used collaborative practice successfully in education. Healthcare. So everyone here, has a health business. So patient care, interdisciplinary collaboration, community empowerment. One of the slides that I shared earlier on, where I talk about methodologies for collaborative practice. I think the last thing I put on there was empowerment. I said if you're inclusive, you're collaborative, and if you do all of those and you identify what skill people need, you will empower people. So that's another key thing from an healthcare point of view. And also for knowledge exchange. My view is that what's the use of knowledge if you don't exchange it? So if you know something and you're the only one that keeps it to yourself, it's not very useful, is it? So the very, very reason why you need knowledge is to be able to share, and it's about how you share this knowledge. And then finally, apart from education research and healthcare, another key activity in collaborative practice and in co-creation is policy development. So if your job involves you developing policy, collaboration, co-creation, it it's a very integral part of that. It can help to inform your policy, and it's very important for things like equity and access, So because, you can't think about everything, and unless you work with the right stakeholder and end users, you're going to miss out key things. And so I don't even know, I can't, for me personally, imagine how anyone can do policy development without thinking about collaborative practice. I just don't know how I will be able to do it. And, and also it covers things like sustainability and resilience. And I think that links to equity and access, because if you bring in all the relevant end users and stakeholders, then it's likely that you will cover all of those. And again, knowledge exchange, and, I did mention that on the healthcare, but I think that's also relevant in knowledge exchange. So this slide, I've used physiotherapy specific examples because I know that most people on this call will be physiotherapy. This is an example of Bruce for inclusion in stakeholder engagement. So just very briefly, I'll mention key points on this slide. So when you're thinking in terms of who do you need to include in your stakeholder engagement, you want to think about patient, client, service users, and people with lived experience. They may not even be patient. They may not be registered. They may not be actively undergoing anything. But whatever it is that your project, your research, your initiative is about, my research evidence suggests that including people with lived experience can be transformational. You should also think about people with professional experience, professional expertise, students who are training in that profession, in this case, physiotherapy, and those who are training the student, the educator, and any other people like GPs, specialists, consultants, specialists, nurses. Sometimes it could even be outside of health. I do physical activity. I have to deal with people that work in social care. I have to deal with people that work in leisure center. They have no health related sort of premise in their day-to-day job. And for you, it might look and feel different. So the main thing here is to think about all those people that you need to include as part of your stakeholder when you're thinking about a collaborative practice. So just bringing it together, delivering collaborative practice through co-creation. So the first thing is to identify what do you want to get out of collaboration. Even this afternoon, the topic I started with is very big. You think, I said I wanted to talk about collaboration in healthcare and in leadership. Collaborative practice in healthcare in itself is a big deal, let alone in leadership. But there are common things. There are common strands that run through all of these, irrespective of where you work or what you do. With your collaboration is identify either a question or the aims of what do you want to get out of it, and then your stakeholder engagement, which is where the earlier slide that I shared comes in useful. Getting in the right stakeholder is key. And then co-creation workshop. So you need to devise a way of facilitating meaningful engagement, dialogue, and collaboration amongst your different stakeholders. There are different, literature, there are different ways of doing this. Some people set up advisory panels. Some people have stakeholder engagement groups. Some people run focus groups. Some people organize interviews. There is no right or wrong way of doing it. I think it just depends on what your question is, what you've identified at the beginning, and who your stakeholder, and, who your stakeholder. But the key thing is making sure that whatever you are doing is meaningful to engage those people, and it must be iterative. So I think this for me is one of the transformational discovery when I started looking at co-creation and collaborative practice. I think this is where this is different to things like PPI, for example, for those of you that do research. People who do research, they're quite often required to demonstrate that they've included relevant stakeholders. But actually, it's collaborative practice is beyond just including people. It is the iterative nature that makes it different. You need to, throughout whatever you're doing, so co-creation in particular, which is why I like to use the word co-creation within collaborative practice. It adopts an iterative approach which continuously seeks feedback from stakeholders and refining the different components. And that linked into the slide I shared earlier on, where I said that you never quite finish, so you need to keep going back and checking. And how you do it, it depends on what the work you're doing and how much money you have, because sometimes this could be expensive. But there are different ways of doing it. For example, if you're working with students, for instance, that should, if you put activity during term time, that shouldn't cost you additional money. And some charity group, we actually fund this kind of work. It's just a matter of looking in the right places. And finally, evaluation and reflection is important. In fact, it's necessary. Ongoing evaluation and reflection are crucial to co-creation, including gathering feedback from stakeholders, measuring outcomes, and identifying areas of improvement. Without doing that, I don't think that co-creation can be truly collaborative, or your collaborative can be said to be co-created. So I think those words, you'll find me using them interchangeably, because I actually don't think you can do one without the other. So what does this mean in practice? So I brought together, for those who came early, is in the chat box. I hope everyone can see it. If you can't see it, you can put a question, and maybe Dr. Demola can help us to repost it. So I've got an example here, which is a training I developed for NHS England with a group of other academics, and that training was adopted by NHS England. It's on the NHS Learning Hub. It's a racial inclusivity research training. I thought to share it this afternoon because I think it's a very good example of collaborative practice, what it means to do something collaboratively. The principle we use for this piece of work is that of co-creation. As I said, the link is in the chat box. I will encourage you to have a look at it after this session. We don't have time to look at it. The training itself takes about 3 hours. Several NHS hospitals have already adopted this, and and with other NHS trusts that are coming along. For example, UCL uses it. I was invited sometimes last month actually to come and contribute to their preceptorship training to do this. Other NHS trusts are doing it. And so I will share, I will click on this. Hopefully it doesn't take me away from it takes me to this side. If it doesn't, I'll just stop sharing and then reshare. So bear with me. I tried, practicing it before I joined the call this afternoon, but it was a little bit hit and miss. And my IT department is not, they're not on hand as it's a Sunday to help. So I'm just going to click on this and hope it takes me there. Okay, so it's taking me to the, can you see race and racial inclusivity in practice education? Dr.
I
Ademola,
think it's just coming up. It's coming up a few things. Currently, what we can say is, what does this mean in practice? Research example.
okay.
Maybe some more.
Okay. All right, that's okay. I will tell you what I'll do so as not to waste our time because it's already showing on my screen. I'm going to stop sharing and then I will go back to, I'll just go directly to the side. So bear with me 1 second instead of trying to share it through my presentation. So I've gone to the site and then I'll just share my screen directly. Just give me a minute to do that. So, so can you see now?
Yes.
Okay. So the
Yes, we
link,
can see you now.
the link that I put in the chat box will take you to this. If you don't have an NHS Learning account, it's very quick and easy to register. Once you have an NHS Learning account, you will be able to go directly onto the site, or you could just pop in racial inclusivity in physiotherapy education, and it will take you. It will take you to this. If you have any problem in accessing this, please let Dr. Ademola know. And this resource is also available on St. George's website, but we'd like to share the one on the NHS website because the one on the St. George's site, if there's any problem, it's not really supported. Whereas with the NHS, there's a whole group of people you can email and they'll come back to you and fix whatever technical issue you might be experiencing. Not that we anticipate there will be any. All the people that have taken this training haven't had any issues at all. So just very quickly, I'm sharing this as an example of collaborative practice. So this is a technology-enhanced racial inclusivity resource in physiotherapy practice education. And I'm delighted to say that since its development and adoption by NHS England, lots of other professions have been using it. For example, I said that I was invited to UCL last month. Actually, there were no physiotherapists from the people that I trained. They were all from, there were nurses, there were ODP, there were radiographer, there were dietitian. They were all healthcare professionals that I deliver this training to. And in my university, I used it for a social work team as well. So it's a very, very versatile tool. And I think the only reason why is this versatile is because it was collaboratively developed. We co-created it. So these people here that you can see here are the academics. So myself, John, Mariel, and Annabelle. But behind this scene and on another slide, so if you actually go into the resources, you will see all our co-creators. There are 10 people who co-created this resource with the 4 academics. And the resource was developed because of the issues experienced by physiotherapy students from the Black, Asian, and minority ethnic group in the UK. And apart from student testimony, research showed that there is a significant award gap between white students and those from racially minoritized groups, particularly in observable assessment. So if you can't see a student and you ask people to mark them, there is no difference in people's ability. The moment they can see that you look different, it becomes a problem. So things like OSCE, practice assessment, practice placement, there is a significant award that exists between those from racialized minority groups and those that are white. And our people from a non-white background, they experience a sense of not feeling belong and kind of feeling very different, particularly when they're on placement. And they report a lot of microaggression and overt racism while on practice placement. And they reported challenges knowing how to seek help. And so that was why we developed it. And so you would think that it would stand to reason that if you're doing this kind of work, you would want to include the end users, which is what we did. So it's nothing groundbreaking. I don't even think it's rocket science, but I think it never ceased to amaze me how many people do things without including all the relevant stakeholders and end user. So the message this afternoon is this is an example of something that can be co-created and is a very good example of collaborative practice. So I'm going to stop sharing this and just make sure that everyone that is joining and that is on the call this morning has a link to the resource, the racial inclusivity training resource. Is if there's anyone who can't see it in the chat box, can you please indicate by raising your hand?
I think I've shared it again in the chat box, possibly.
Okay, please do take time to have a look at it. Thank you, Dr. Ajile. You're giving it a thumbs up. It takes about 3 hours. I think we have on there about 15 videos. Those videos that you see in that resources, they're real. We use actors to protect the identity of the students. But the video, the racial profile, everything that you see in that video, we took it verbatim from a previous study that we did, where we interviewed students from Black, Asian, and minority ethnic groups to try and explore their experiences on placement. So they're real. Nothing was added to the video. The only thing that is different was that we employed actors and we paid them to protect the identity of the student that took part in that. And so it's a good example of collaborative practice. And I encourage you to look at the evaluation document as well, because we're not just saying that it works, there is evidence to support that assertion that collaborative practice benefits people. And so I have another example that I want to share with you, because that example that I just shared is more from a research project type standpoint. So if your work involves managing other people, so in effect, if you want to think about collaborative practice in leadership, my suggestion is you would need to approach it differently. You are not now thinking about what you're doing or how you're empowering others to deliver collaborative practice. So I've got a thing you can just scan. So I'll share my screen, but if that, for whatever reason, doesn't work for you, you can always refer to the link in the chat box. So I don't know if this is sharing now. Can you see?
Yeah, it's coming up.
And what can you see? Can you read out what you can see?
Leadership strategy to view co-creation strategy. Please scan.
Yeah. So I'm sharing with you an example of a leadership strategy for collaborative practice that I developed for my university, specifically for my school, School of Health and Social Care Profession, but actually is in the process of being adopted by the wider university. My university, I want to adopt this strategy now. And I think it's important to look at it slightly differently, because the work that I shared with you earlier on, as I said, I shared it's a project type work, it's a research type work. If you're managing people, you need to empower them. And what this strategy does is an example of how you can empower people, how you can set down framework so that you're not the only one that is doing collaboration. Other people that you're managing, people you're working with, they're also being collaborative in their practice, because in actual sense, you can't do it alone. So if you work in a place and you're the person that understand collaborative practice, I would argue that you're not being collaborative, because true collaboration extends to other people. And that strategy, which I shared, or it's in the link. If you've got your phone, just point your phone at the screen, and you'll be able to see, um, you'll be able to see it. I'm just checking that it works. It works for me. I hope it works for others. Okay, so I'm going to leave that. I'm not actually going to go into that strategy because of time, but it's a very, very good example of how to use, what collaborative practice means in actual practice. Co-creation work signifies a commitment to inclusivity, creativity, and empowerment, as I said earlier on. So anything you do that you want to include other people, it shows that you're inclusive, you're creative, and you want to empower people. And I'm excited to bring this way of working to all areas of practice. So no matter what you do, whether you're a clinician, you're an academic, or you manage people, you can certainly do collaborative work. It promotes diversity, ensure equitable access to opportunities, and cultivates an atmosphere where all voices are heard, valued, and celebrated. And collaboration works with co-creation and vice versa. I don't think you can do one without the other, which is, as I said, I tend to use them interchangeably. Before I open the floor for questioning, these are the ongoing research collaboration activities that I'm currently involved in. So if you're interested in any one of these, please feel free to reach out to me. Some of the people I do this work with, they're spread across the globe. So location is no barrier. So I'm interested in simulation-based learning as part of my collaborative practice portfolio. I look at physical activity. I look at different ways of co-creation. I'm interested in sedentary behavior and, so just to give you a few seconds to look at these, and please reach out if any of these is interested. If you're interested in any of these. And now I'm going to open the floor for questions.
Thank you very much, Dr. Dairu. Just to point out, the scan worked, and I've done it here, so that's very good. Thank you. Now, before I throw the floor open for questions, just to quickly introduce one more person who had been here from the start. I just thought he's part of the house. Let me put it that way. So it didn't occur to me, but I think I'll just quickly introduce Dr. Victor Huti, who is a member of the steering group of the Nigerian Physiotherapists UK. Actually, he's the chair of the Constitution Development Committee. He's got a lot of work to do with us this afternoon, later on. Thank you, and you're welcome, Dr. Huti. Now, to my question for you, Dr. Dairu, I think mine borders more on the aspect of quality assurance. Because in everything, there has to be a kind of standards. In Oxford, we will say any practice that's not evidence-based is quackery. You're a quack if you are not practicing what is there as evidence. And that's why we have evidence-based. We talk about randomized control trials, gold standard, and all that. Now, you are an illuminating light when it comes to co-creation. This year, you have been appointed by the into the predoctoral funding committee of the National Institute for Health and Care Research, and you've done a lot of work with the NHS, some of which you have mentioned as well. So definitely, the evidence is there. However, in co-creation, what are in place in terms of quality assurance tools? What will you be looking for as necessary ingredients that makes any such work the right standard?
Okay, thank you very much. That's a very interesting and relevant point. As part of my presentation, I think it was one of the earliest slides that I shared. I talked about methods of fostering inclusive engagement. And so those are those things, whether quality assurance or otherwise, those are the things I will be recommending. Those are the things that people need to be looking at. Whatever it is you do, you have to be inclusive in your approach. Being inclusive means removing barriers to participation, whatever that barriers might be. It could be physical barriers, it could be something to do with people's health, it could be a participation barrier, it could be a societal barrier, it could be cultural, whatever that might be. So that would be the first thing that I advocate for. And the other thing is about just being creative, think outside of the box. Because human beings, we don't always follow manuals. You know, we're very different. You know, and you know, we come in all shape and sizes, and so it never ceases to amaze me that most things are kind of box standard, and as if we're all the same. So be creative in pursuing that inclusion, and don't be shy away in identifying where training is needed, you know. So if people need to be trained, if organizations need to be trained, you know, you look at it. And finally, the goal has to be one of empowerment. So you're not just including people for including sake, you are including them in order to empower them. Does that answer your question?
Yeah, thank you.
Okay, sorry, I can't see I think I've got my presentation showing, so I can't see you. But
Thank you very much.
okay.
Yes,
Yeah,
it does. It does.
I can see you now. So any other question?
I think we'll give the next 10 minutes to people, please. If you have any question.
I have a comment, probably not a question, but a question might develop from my comment. Thank you for that insightful and quite educational presentation. I think the idea of collaborative practice is gaining currency now in every aspect. I'm not a physiotherapist. I'm a consultant psychiatrist and I'm a clinical director, and I've seen, you know, that a lot of the work that we do now in healthcare delivery, in service delivery, you know, policy development, involves co-production, and a lot of it is not, you know, top down anymore. I think it's a ground up kind of approach in which we now have to include a lot of people with lived experiences, expert by experiences, even in interviews, even in recruitment. So I can see that the application of collaborative practice is, you know, permeating all aspects of delivery of any kind, either in healthcare, in education, research, and I think this is just an example of how, again, we can apply that co-creation and co-producing, you know, quality work in what we do. And I'm blessed to have attended these because I'm just yesterday I was just trying to put to paper a sort of a mini audit. I won't call it audit actually, it's a service evaluation kind of project I want to do with my team. And I was thinking in my head, who would I produce this with? Who would I incorporate into that? I think this lecture has actually sort of helped me to sort of, decide how to approach things and who else will be part of that service evaluation project. And I want to say a big thank you for that. I think the question that I may want to ask is probably not too far away from what Dr. Adekunle has asked in terms of monitoring quality and also how do you ensure that reflection is standardized as well. Because in some of these things, when you have other people who are not, let's say, as knowledgeable in that particular subject as you are, and you are co-producing it with them, how do you sort of make sure that there's, there's some degree of standardization and you bring everybody to that level? I know you talked about empowerment skills, identification, education, but that also may delay, also could affect the way, the stream of things. So how do you sort of manage that dynamics in that situation, in your experience?
Yes. No, again, I think that's a very valid question. And I get asked this all the time. I think the first thing I would like to say, if I may, is that it's actually not up to you. It's up to everyone who is including those people that you're trying to bring along. So and I think that's one of the things with collaborative practice. The onus doesn't sit with anyone. Is a collective responsibility and is a collective approach. And so it may be time consuming because sometimes you might find it easier to just sit down in your office behind a computer and think about a whole set of ideas. But when you think in terms of collaborative practice, you're working with other people, you are representing other people's views. And in terms of kind of reducing that barriers, that comes from everybody. So I wouldn't anticipate that you will be the one coming up with a solution. It will be a collaborative approach to finding solutions to reduce the barriers to inclusion and engagement. And that can mean anything, which is why I gave myself as an example during the presentation. So very quickly, it is not up to you, it's up to everyone. It may be time consuming, but it does pay off in the end. And what I've found from experience is that you actually start to develop a network of experts without realizing it. So if you do a piece of work and other people are involved with you and you had to spend a lot of time training them, next time if you bring them onto another piece of work, what you will find out is they require less training. And if you embed collaborative practice as an ethos and as a way of life, it does have a snowballing effect. And you will get to a point that the training will not be so much of an issue. And it will be less of an issue. But initially, prepare to invest time, and the solution comes not from you or from an individual, it's a collective approach to finding what works and how to be inclusive and engaging. Does that answer your question?
Thank you very much, Dr. Dairo. That's very, thank you.
The floor is open. Any question from any of us here?
Good afternoon, Dr. Dairo. Can you hear me, everyone?
Yes, we can.
Yeah, it's Peter speaking. Thank you very much for the presentation. What I want to say really is, if you look at what is going on now, you would look at the start last year, which is like we have almost 7% of the population that is now going into, private healthcare because of the problems, regarding, strikes in NHS, and other problems associated with, NHS. So what I want to say really is, we're having so much trends now, people going up and down, looking for private practice. and at the same time, private healthcare. So what are we doing, or what are you trying to, in terms of extending this, kind of project, to private sector? Because, going forward in the future, you will discover that, those part of healthcare is going to be alienated, and then we're going to have a kind of, two tiers of people not really knowing how, to handle this. Because I work in the private sector, I've seen so many things going on there. And then that kind of a sector is becoming more visible and more adaptable to most people, especially if you can afford it. So people are thinking about it. We have over 600,000 people now registered, within the last 2 years, to offer private healthcare. So I will be thinking, is there any work you guys are doing, to extend this type of project into private practice or private healthcare?
Yes, thank you. That's a very, very important and relevant question, and very contemporary as well, especially if you live in the UK. I think why we haven't targeted private sector specifically, from the work that I do, they're actually very keen. For example, the strategy that I wrote for my school that I shared in the or within my presentation and in the chat box, when we launched that strategy, I was pleasantly surprised that in High Wycombe, where my university is based, the biggest private physiotherapy providers, the two biggest private providers within the area, they came in for the launch, and they've since been in touch with me, and they've been very involved, and they want to see how they can be involved more. I think the people in private practice, cost and cost effectiveness, it's very key on their mind. And when you look at collaborative practice, on the face of it, it might seem expensive, but when you look at what you get out of it at the end, is a cost-effective way of working. And a lot of private providers, they're buying into it because they're realizing that even though they're investing a little bit more time in being collaborative, it's cost effective for them down the line. So we haven't done anything specifically to target them, but I think the people are smart enough to recognize that this is the way forward, and they're buying into it. But you're right, there's more work that needs to be done. If you have any avenue or ways, I'm very much happy to be involved if you contact me.
Yeah, thank you very much. That's all right. Thank you.
Thank you very much, Mr. Ajayi. Okay, any more questions? It's been a very exciting session. Thank you all. Thank you very much, our guest speaker, Dr. Yetunde Dairo. Very grateful for that. We would end this session now, and for the members of the MPT UK, if I may just seize this opportunity to say we'll be back via another link at 6 p.m. That's about 20 minutes from now for the special general meeting. Thank you very much. Bye-bye all.
Thank you. And it's lovely to see so many people. I can see faces, like I said, people that I haven't seen like in 30 years, despite being Father's Day. And it is nice for people to take time out of their Sunday. Temi, Fumi, Kenny, Kola, yeah, Mo. All right. Thank you, everyone. Bye-bye.
Thank you. Bye-bye.
Bye. Bye.
Bye-bye. Bye.
Thank you, Yetunde.
You're welcome. Thank you. Oh, is that Tony? To you, Wade.
I'm just saying late now. I'm just
Hey. Oh, yes, ma'am. Bye.
Let's not hijack the general meeting. Thank you, everyone. Thank you for showing
Bye-bye.
up. Thank you,
Bye.
Kenny.
Thank you.
Yeti Kampe,
Yes, so
Well done. Yes,
is BF talking. BF.
oh, BS.
It would be lovely if we can take a
Oh.
picture. If everybody is happy, we can
Oh
just.
no, people have gone. But
Oh,
if
they
you
are okay.
let's
We'll
see
do
your
that
face.
next
We
time.
can we can still do a picture. Ajayi BF. Oh, how very nice. Kenny Long.
Bye.
Okay,
I
bye-bye.
know. Thank you. No, take a picture before you
Okay,
go.
yeah.
Take a picture.
Okay, if the
Show
rest of
your
us
face.
just if you
Aja-
are happy, take your video. I mean, show your face and okay. Thank you. I've done that now.
Okay. All
Thank you
right.
very
Thank
much.
you,
Am I sure?
everyone. Thank you for your time. Bye-bye.
Yeah, we can see you. Bye-bye.
Bye.